So I've done the intake interview with a nice nurse named Jenny, and now we're in an exam room. Can I show you guys on camera? With my mother-in-law and my daughter, Charlotte and Mary. Well, Charlotte and Mary Charlotte. And we are waiting for Dr. Mahaney to come in. So I still don't know anything more, and I'm not gonna go live with this. I'll just edit it together. More later. So here I am with my breast surgeon, Dr. Susan Mahaney, who has explained everything to me very thoroughly, and I'll make a video later, and we'll edit all of this together so I can let you guys know exactly what's going on this unexpected journey that I find myself on.
Fine.
Wait, go say that again. Yep.
She's going to do fine.
Yes. So now I'm in a consultation room and with a lady named Krista who is called, I think, an oncology patient navigator.
You got it.
So for these dark waters that we'll be navigating. And I'm not sure what all we're gonna talk about, but when I make the longer video later, I will let you guys know. Hi, family and friends. I told you I would make a longer video this evening to tell you about my appointment with the surgeon today. So here it is. My daughter Mary and my mother-in-law Charlotte went with me today to meet Dr. Susan Mahaney, who is a breast surgeon here in Savannah. And she explained my type of breast cancer, the protocol for treatment, and that I'm going to have some choices to make about surgery. And then we met with the oncology patient navigator, who's a lady named Krista, who was wonderful. And she went through in detail all of the aspects of breast cancer treatment, everything from the chemo to genetic testing, to attitude and nutrition and everything. And Mary and Charlotte were there with me through all of it. And then we went out to eat afterwards. So that was really nice. I, in case you haven't noticed, am not incredibly comfortable in front of a camera, which is a little interesting because I'm completely comfortable in front of a room of live audience, especially teenagers or college-age students. That doesn't bother me at all, but speaking into a camera seems really odd. So I'm hoping I'll get better at this as we go along. So here's what I found out today. I have invasive ductal carcinoma, and they give them a grade of 1, 2, or 3, depending on how fast they grow. 3 being the fastest, and mine is grade 3. They're right now saying clinical stage 1B, unless they find out that, I guess, that it has metastasized to any other parts of my body. And if you know anything about cancer treatment, it is what's called triple negative breast cancer. They test breast cancer to see if it has estrogen receptors, so it can be ER positive or ER negative, progesterone receptors, so it can be PR positive or negative, and then HER2 positive or negative, which is a human hormone. And mine is negative for all 3 of those, which means that it doesn't feed on estrogen or progesterone or this other hormone. That's it in a nutshell. Some people have triple positive breast cancer. Some people have triple negative. Some have some of those factors positive and some negative. So basically what this tells them is what medicines they need to use to kill the cancer, and also maybe what type of surgery you have to have. Now, the other factor in my surgery will be genetic testing, because if this cancer does turn out to be connected to the BRCA1 or BRCA2 gene, or they're going to test like 70 other genes, then I probably will wind up needing a double mastectomy eventually. But this is the way things are going to go. With this type of cancer, they have found the best kind of treatment is to hit it with chemo first before you have any kind of surgery, whether it's just surgery to take out a lump or take off one breast or take off both. So next week I have to have an MRI of my breasts and my armpit areas, my axillary areas. Then the following week I'm going to have what's called a port inserted, and it'll go, the breast cancer's on this side, so it will go in on the right hand side. And this, if you don't know what it is, look up Portacath online. It's basically port with a catheter under your skin into a vein so that they can numb just a small area of skin, put a needle in, and give chemo and also do blood draws. This will prevent them from having to constantly stick me with needles to start IVs and to draw blood. Because there are two protocols for chemo, at least this is my understanding from Dr. Mahaney. Two protocols that I might have. One of them takes about 3 or 4 months, and the other one takes 5 or 6 months. So I won't know about that until I meet with the oncologist. But I don't want to be being stuck with needles constantly for possibly 6 months. My oncologist is going to be a doctor named Dr. Jennifer Yanucci, and I actually went to her years ago now, probably 7 or 8 years ago, when I was severely anemic, because she's a hematologist and oncologist, and she helped me with iron studies and iron levels and helped me with that then. So when her name came up as somebody who could possibly be a good oncologist for me to have, I wanted to go to her. I have a cheat sheet here, by the way. So MRI first, then the port, and then chemo could start as early as February 14th. I don't know all the details on that yet. I will share more with you. It occurred to me today that as much as I love learning all the time, learning new things, this is one area of life that I really would be just fine not having ever learned about. That's how I felt when our daughter Mary had an aneurysm at age 3 in her brain, cerebral aneurysm. It's how I felt when our son Bobby had lymphoma when he was 8. And then it's how I felt 2 years ago when Mary had thyroid cancer. Our family has been through a lot medically, and we try to eat healthily, wisely, and exercise regularly, and live clean, wholesome lives. And it just goes to show you our world is a fallen world, and it's a toxic world. And many, many people are getting diseases through no fault of their own. The estimates now are that 1 in 8 women in this country will have breast cancer before they reach old age. I want to ask for prayer for some specific things, obviously for healing and that all of this treatment will work. Prayer that I will tolerate the chemo well. There are so many possible side effects, and that's a little daunting. I'd like to ask for prayer for my medical team, Dr. Mahaney, Dr. Yanucci, and for Krista Alifi, who is the patient advocate, the patient navigator. They have really tough jobs, particularly the breast surgeons and the patient navigator. I mean, they are dealing with people all day long, telling them they have breast cancer, telling them they need chemo, and it must be a tough job. So pray for them. Pray for my family, for Eric and my children, because it's hard for them also, really hard for them. Please pray for my students because this semester is going to be difficult for them. I will be losing my hair sometime after round 1 of chemo. They said probably between rounds 2 and 3. I'm going to get weak. I'm going to have issues, and I teach college courses, but I teach them to high schoolers. So they are 17 and 18 years old, some of them as young as 16. And I think it's going to be hard for them because I have great students, 5 classes of just really, really great young men and women that God has blessed me with this semester. And I know that it's going to be hard on them to see their professor going through this. So pray for them too. I'm going to list prayer requests on the Facebook page that Carolyn and I made this evening. And I'll do some more updating tomorrow. I need to go to bed now because I'm running a 10K in the morning, the Kreitz Tybee Run Fest. I'm running the 10K. The other thing I want to let you know is an idea that my friend Holly Lang Strawn, who is undergoing treatment for breast cancer herself, I hope it's okay for me to say that, Holly. She gave me this idea to make a wish list on Amazon. I told my niece, Michelle Wheelock, that it's kind of like a baby gift registry or a wedding gift registry, but not for quite as fun a reason. And what it is things that have been recommended to me that will be helpful for me to get through chemo. I have several friends who unfortunately have gone through breast cancer and they're either out the other side or they're still in treatment, and they've been sending me ideas and recommendations. So I'm going to make a list on there. It's going to be called Alice's Cancer Wish List or Alice's Cancer Treatment Wish List. If anybody has a really interesting name idea, please pass it along. And that way, I think so many people have said to me, what can we do besides pray and be supportive? That's something concrete that you could do that would help our family out, if you want to do that. I hate asking for stuff. I just hate that. But I also think that that's one way that you could help. And when we need other help, like rides, places, or meals, we will let people know. We are not too proud to ask for help. So that's it, guys. I love you all. Thank you for praying. Oh, I wanted to show you one thing. I came home with tons of reading material. They gave me book after book after book, booklets, and a magazine that's actually called Triple Negative Breast Cancer. So, you know, I have lots of reading to do, lots of catching up to do with, I feel like I'm behind the curve finding out about this. So I will probably make another video tomorrow with scenes from the 10K and maybe answer any questions that you send me about what's going on. All right, good night.